I'm Paula Collins. I'm the Senior Policy Advisor for Healthy Responsible Students for the State Board of Education. We have just recently learned from the National Association of State Boards of Ed that North Carolina is the only state board who has a full-time health policy advisor for the state. We're very excited about that because it shows that our State Board of Education really does embrace the importance of healthy, responsible students and its impact on greater academic achievement. I'm very proud of the leadership of our decision makers, both in the General Assembly, at the state board level, and in our LEAs. I think looking at statewide policy is a very different thing than implementing it at the local level, and it takes both. It takes the vision and the management to make that possible.
18, 21, 24.
In North Carolina, we like to talk about improving graduation rates. We have about a 70% graduation rate for our students, and we want to increase that. One of the ways we feel that that is possible is by looking at the health status of our students. We know that there is a definite link between a student's health status and their academic achievement. The Healthy Active Children policy was adopted in 2003 and amended in 2005, and it has 5 components, and they're very simple to follow. The first looks at a coordinated school health program. Another piece focuses on physical activity, and North Carolina was one of the first states in the nation to require a Healthy Active Children policy looking at 30 minutes a day for physical activity. The third part of the Healthy Active Children policy is we look at the recess efforts. We do not want to withhold recess from students as punishment, nor assign excessive activity as punishment, because that is counterproductive to the student's day. We know that our schools want to do the right thing for healthy, active children, and one of the best things that the schools can do to make sure that this happens is to really look at their School Health Advisory Council. Many of our school systems now have established a health council or a wellness team, if you will, at the school level. I think it's key that there is some sort of assessment that is conducted so that schools know what they need to work on. Yes. If they conduct an assessment, they can determine, well, hey, we're doing pretty well with activity, but we need to look at nutrition. Or we have great support of our parents, but our decision makers really don't seem to embrace this. Or our local board, for example, really has not enforced this policy. We also have the piece about reporting, and this is an accountability piece for the schools. Many times, as you know, there could be a law or a policy that is in place, but without the accountability, it is not implemented in a uniform way. What the State Board of Education has requested is that each LEA every year by July the 15th reports back to the State Board on what has happened with their policy, and it looks at each of these components. It helps our students when they have been active to increase their concentration. They have greater productivity, better morale in the classroom. They actually enjoy learning, and we know that when learning is fun, students are more likely to recall that information, but more importantly, to apply what they have learned in other areas of their school day. We know that healthy, active children learn better. For example, our research shows that there's reduction in dropout rates for healthier children. We know that healthier, active children have greater academic performance in end-of-grade and end-of-course tests, improved concentration in and outside the classroom, and there's a great reduction in hyperactive behavior. We also know there's less school misbehavior, so that means there's less school suspensions and expulsions. Good job. There is definite research to support the link between academic gains and eating a proper breakfast. We also know that students that have breakfast are more likely to attend school. The absence rate is much lower, and conversely, in a study recently, it showed that students that did not have breakfast had higher days of being absent or tardy. If breakfast is not provided, then the students' attendance and concentration is impacted. The State Board of Education has adopted nutrition standards for all foods being served in North Carolina schools. We want to make sure that the standards are the healthiest that they can be and that they are attainable. What we want are our nutrition standards in place that are affordable for our school cafeterias to prepare, but for students to also purchase. Wellness policies require a lot of work but show a great deal of impact on the healthy school environment. We know that in North Carolina, the schools report back to the Child Nutrition Program Director at the Department of Public Instruction. And so this reporting piece gives them a chance to show that not only are they in compliance with what the policy request, but it helps them to do a study of where they are and where they want to move. So it's a benefit in planning and in reporting, and I hope our schools will take the time to brag a little bit and tell about their success stories. There are many of our LEAs that are making a great deal of difference in the lives of students.
They stuck to their plan day after day. Diet and exercise at work and at play.
There are numerous obesity prevention efforts taking place, both voluntarily and mandated by the state and federal government. In North Carolina, the basis for what drives our curriculum is the North Carolina Standard Course of Study for Healthful Living. In this document, it's a K-12 document that points out the goals and objectives of what should be taught in health education and physical education. I think all of our schools have the capacity to embrace obesity prevention. I believe that once everyone reaches the critical mass, about 15 years ago when the tobacco prevention efforts were in place, everybody was working in a piecemeal fashion to address tobacco use prevention. I believe that's where we are now with obesity. I think the nation, the community at large, our schools, families, even the workplace is looking at the impact of health on their productivity. I believe all of our schools have the ability and capability to make a difference. My wish for the schools would be that there is a new way of doing business, that the health environment, what is being taught, the safety, the nutrition, the activity, that it just becomes a new way of doing business, that it's not an add-on, it's not a program or a special project, but that it is institutionalized throughout the school day. And it's just a way of operating.